Hello and welcome to chapter 10. Oh, that said something. Alright, it is called Principles of Emergency and Disaster Preparedness. In this chapter, we're going to apply triage principles to prioritize care and delivery. Along with talking about the role of the nurse during emergency preparedness and response, develop our own personal emergency prepared plan, and how we deal with emergencies and the post phase of emergencies. In 2020, we are living this. We, as Americans, are seeing if we are ready for emergency preparedness. And when we think of this, emergency and disaster preparedness, it's defined as disasters defined as an event in which illness or injuries exceed the resources, capabilities of a healthcare facility or community because of destruction or devastation. Well, it's being destroyed today by COVID-19 or the coronavirus. So when we look at this, we're having, I would say, there's two types, internal and external. I would say where we are today, we're trying to stay below the line of healthcare capacity. Right now, I'm recording this on Sunday, March 12th, so we're all in self-isolate, March 12th, 2020. We're all in self-isolation, or should be. We should not be having group parties of more than 10 people. So that's why we're doing this for the end of this month. Hopefully it doesn't have to continue. I may upset you all and say it's probably going to. So when we think of disaster, we know it's an event. I already said that. Internal disasters. It's any event inside a healthcare facility or campus that could endanger the safety or patient well-being. When I think of internal disasters, it's part of also an external because it was in St. Joe's when the tornado hit, so the hospital, had all this thing. So they can happen together. Externals, any event outside the healthcare facility somewhere in the community which requires the activation of the facility's emergency management plan. The number of facility and staff resources may not be adequate for the incoming ED patients. Externals can be natural, such as a hurricane, technological, such as an act of terrorism, malfunction of a nuclear reactor with radiation exposure. Both an internal disaster could be like there's a fire in the hospital. Both can result in many casualties, including death. I would say external disasters, the COVID-19 or the coronavirus. So when we think of this, we think there can be multi-casualty or mass casualty. As we, right now, Hannibal Regional, the Hannibal area, and probably Adams County, which is Quincy, they're managing this multi-casualty. They're managing by hospital using local resources. Well, probably not. Probably mass casualty because we're running out of PPE. Mass casualties, the local medical capabilities are overwhelmed. I would say currently in 2020, this is a nationwide problem. We're required to collaborate with multiple agencies and healthcare facilities to handle the crisis. If you turn on the news every day, anytime in the after 12 p.m., a governor of a surrounding state or a president, they're giving their daily briefings to prepare us for this mass casualty that's coming. No one really we have plans for a pandemic, the government does, but when we plan for these before the COVID-19, we've done drills for school bus accidents that could happen. So that could be a multi-casualty. We're going to manage this. 10 kids get hurt on a bus. Downtown get hit by a train. We can handle that. Mass casualties like a tornado comes to the area and destroys 1,000 homes. Trauma centers play a critical role because they can accept multiple patients. Oh, wait. Okay, sorry, I thought I lost my slide, so I wanted to make sure I didn't have to start over. Alright, so we have emergency preparedness plans. The Joint Commission that accredits hospitals, we have to at least do 2 emergency preparedness plans each year. And in this area, we're going to do a tornado and fire. Are we really going to do an earthquake drill or a hurricane drill? No. But because of our area, that's what we're going to do. If we lived in Florida, we'd be doing the others. You also have to plan an event that must occur in that particular community, such as a school bus accident that would happen. Nursing homes and other long-term facilities are also mandated to have annual drills to prepare for these mass casualty events. They have to have a plan to evacuate residents from the facility in a timely and safe manner. And, what's funny is the other day I was working in the emergency department, and this little old lady, the fire alarm went off at the facility, and on her way back to her room, she fell. Luckily, she did not break anything, but she could have. And then we're going to talk about the Life Safety Code. It's published by the National Fire Protection Association. So CMS requires every healthcare facility to practice at least 1 fire drill or actual fire response drill annually. I would say they do these more often at Hamilton Regional, so we're prepared. These provide guidelines for building construction, design, and maintenance and evacuation. And on page 150 in your textbook chart, 10.1 talks about best practices. And if you can remember RACE, the acronym RACE, in case there's a fire, we're going to rescue any patient who's in immediate danger and get them to a safe area as fast as possible. We're going to pull the alarm after we have everyone removed out of danger. We want to contain the fire by closing doors and windows behind you as you evacuate patients. And then, if the fire is small and you've been trained, you can attempt to extinguish the fire. Don't risk yourself or other staff members while moving patients. When we think of external disasters that we've seen in today's society, 2001, September 11th, changed disaster planning. Nobody knew that the Twin Towers were going to get attacked in the Pentagon and the loss of life in a field in Pennsylvania. We weren't prepared for this threat of terrorism. Also, we had anthrax exposure that followed. So hospitals' preparedness concepts became integrated into the daily operations of emergency departments. We look at nuclear, biological, and chemical threats. We're trying to improve safety by upgrading the decontamination facilities and equipment. Nurses in the emergency department and physicians must undergo hazmat training. Because of the chemicals that are used, we need to understand the patterns of illness in patients who present for treatment that potentially indicate biological terrorism agents, such as anthrax or smallpox. So on this patient, these people are gowned up in these big masks, gloves, and they have brushes because if a patient has anthrax on them, you're going to scrub it off, and you're protecting yourself in this big hazmat suit. You're also going to see these hazmat suits in today's society due to COVID-19. Protocols for pharmacological treatment. If somebody did have a biological chemical on it, you need to have the antidotes readily available. Hurricane Katrina. This happened in 2005. It was a hurricane in New Orleans, Louisiana. And critical systems failed at this time. So this has changed how we respond to environmental catastrophes. During this time, not all basic human needs were met. They didn't have access to water. They didn't have response to stabilize these patients. So just be aware of that. These disasters and others help us plan better for pandemic infections. such as, in today's world, COVID-19, and other ones that we've seen is the Superstorm Sandy, which was what was it was a hurricane that happened outside of New York. We've had tsunamis in Japan. We've prepared for terrorist attacks, and we're also now living in a pandemic world. I honestly never thought we'd see a pandemic. I mean, we teach you it, but wow, we're living it. COVID-19 or the coronavirus, here's a couple of videos that are good to watch. One's just a PDF file. Let's see if I can. If you've not read about it, you definitely should. COVID-19 and the coronavirus. It leads to inflammation and buildup of mucus and fluid in the airways of the lung. The chest, I know this says pneumonia over here. The chest x-ray on patients with COVID-19 actually looks like acute respiratory distress failure. Not really a pneumonia on the x-ray. We want to keep our 6 feet distance because it's a virus. You can breathe in the droplets. You're more likely to develop this condition if you live or travel in an area with COVID-19 outbreak. So China, New York City, Washington State, New Orleans. I wouldn't recommend taking the train to Chicago right now. Signs and symptoms include a fever, a temperature of 100.4 or greater, cough, and difficulty breathing. You can have not diarrhea with it. You can also, 3% of cases are showing pink eye. How was this diagnosed? Well, you get a nasal swab from your nose. They were doing throat swabs, but mainly it's now the nasal swab. And this just talks how to prevent it. You're going to wash your hands, don't travel, stay 6 feet away. We're doing social distancing. If you want more information, so just be aware that that's out there. And this other one's a video. It's really good. It's like by Ninja Nerd. It's about an hour long. I watched it the other day. It was very interesting to me. Oops. So we're social distancing. We're all in our homes. You know, during this pandemic, whoever thought that a year and a half ago, I taught you all that are graduating in May of 2020 to throw away your mask after each use. And now, in today's world, an N95 mask should last you your whole 12-hour shift. If you come in contact with a patient who's suspected for COVID, you're obviously going to change it. Your textbook says that the United States government stockpiles critical equipment and supplies in cases they are needed for a pandemic. Well, we're past that point. Each state's pretty much out looking for their own equipment, each hospital. So we are reusing equipment. We're at Hannibal Regional, we used to all wear disposable gowns, and now we are wearing the washable gowns. So when COVID-19 comes to the area, we need to be ready for this. But we're going to talk about a bus accident. Sorry, I went back a screen. We're going to talk like a bus accident happened in downtown Hannibal, Missouri. There were 30 kids on it and 10 adults, including the bus driver. And we need to triage these patients. And they were hit by a train going 5 miles an hour. That's all we know. 30 kids hit by a train. The train conductor's fine. So we need to mass casualty triage these patients. So this is a way to effectively triage to rapidly sort ill or injured patients into priority categories. Bystanders will always be the first on the scene of a disaster, and then EMS. This is a key process that I said to triage. Triage function may be performed by EMS, such as EMTs or paramedics. There may be nurses or physicians called to the disaster scene. So there's a disaster triage system. In the red patients, usually there's like a tag and it has in the order red, yellow, green, black. And you're going to rip off the color that you want the last one to be. So red patients. These are emergent patients. They're identified with a red tag. These are patients who have possible airway obstruction or they are in shock. They require immediate attention. Yellow patients, they can wait for a short time for care, usually 30 minutes up to 2 hours. Examples of these patients are patients they may have an open fracture with a distal pulse. They could have a large wound to their leg that's not bleeding a lot. Our next patients are non-urgent or walking wounded patients. These patients can wait over 2 hours for minor injuries. And they could actually take themselves to the hospital or evacuate themselves from the mass casualty scene and go to the hospital in a private vehicle. The red and yellow patients need to go via EMS. Black patients, these patients are expected to die or are already dead. They have multiple problems. An example of this, they're going to use too many resources. So a patient with agonal breathing. This mass casualty triage system was implemented in the military when the overall desired outcome of doing the greatest good for the greatest number of people. A lot of times the black patients that are tagged are massive head traumas. They have extensive full thickness body burns, like 90% or greater, and high cervical spinal injuries. And we'll talk about that in a little bit. This is a cute little disaster video you can watch. So, the nurse is preparing to triage clients at the scene of an airplane crash. Which of these clients will identify as emergent or a red tag? A young woman with closed fractures of her right leg and arm. Probably not, but we can keep that. An older woman with abdominal bleeding who is dazed and confused. Yeah, that sounds like she's pretty emergent. She's got abdominal bleeding, she's dazed, she's confused, maybe some neurological things. C, a middle-aged man with third-degree burns over 90% of his body. Well, we're probably not going to be able to save the middle-aged man, and he's going to be black. The young man with so far we're going with B. Young man with numerous bruises and superficial laceration. I would tag him as a green. So our answer for this question is B. An older woman with abdominal bleeding who is dazed and confused would be that. And the letter A1, young woman with closed fractures, she'd probably be a yellow. You also want to continue to reassess these patients if you can as you go through, because their respiratory status could change, their neurological status could change. So, now we're at this bus accident, and we're going to notify and activate EMS or in the hospital. And we need to notify them. We know this is a mass casualty when the number of casualties exceeds the usual resources capabilities. So, and this can vary on the size of the hospital. Hannibal Regional, we could probably handle a lot. Probably 10 or 15. But we may need help from Blessing. I'm going to use radio, cellular, and electronic communication. There's going to be some internal facility notification between the emergency department and EMS. If you've been in the emergency department for your clinical rotation, you've noticed that there's a phone there that only EMS uses. You're going to identify somebody in public relations department to do the media broadcast message via radio, TV, or social media. You've seen that today in today's society. The governors, in 2020, the governors giving their daily update, the president. You've seen Maureen Kahn from Blessing Hospital giving daily or weekly updates. You may need to initiate help, like New York City has from the National Guard. the American Red Cross, the public health departments. Their job is highly important right now because they have to do tracebacks of whoever, when those patients are diagnosed with COVID-19, they're seeing who else has been exposed. You know, if they work at Walmart, what people were there on Walmart on that day or in the last week or few days? Military units may need to be deployed, such as COVID-19, Medical Reserve Corps, and Disaster Medical Assistance Team. So there's an ICU nurse and our night house supervisor works for, they're like in the Army Reserve, and they've gotten called out to like New York. So just be aware. A catastrophic event, such as a major earthquake or tornado, requires collaboration of volunteers for all healthcare providers. I'm not just going to sit at home and just wait for the hospital to call me to volunteer for this COVID-19 influx of hospital patients. They're going to be calling and saying, we need you. During this time when we have a mass casualty, nurses may be placed in unstable environments. They might not know what to do. So where do you want to assign these patients to the best of their ability? If they have a medical background, like they work med-surg, you know that they can handle some abdominal pain patients. And they could handle maybe a patient with some minor vaginal bleeding. Are we going to give them a woman active in labor? No, probably not. And I'm going to stop right there on this slide, and then I'll upload part 2 in a minute.